It's a pleasure to be here this afternoon to present the 2018 Cancer Society Volunteer Leadership Award, which honors those whose commitment to fighting cancer sets an extraordinary standard of community service and reflects a deep commitment to the American Cancer Society's mission. Each year, a dedicated volunteer work group reviews all the nominations and selects the awardees. That work group is here with us today, and I'd like to ask those dedicated volunteers that are in the room to please stand and be recognized. Thank you for your work. This year we have two recipients, and both truly exemplify the spirit of this award. Their leadership has not only helped the American Cancer Society operate more effectively, they are inspirational and collaborative leaders who have encouraged volunteers and staff during times of change so we can come together to attack cancer from every angle. Unfortunately, one of the awardees, Stephanie LaFord, was not able to join us today, but we certainly want to recognize and thank her for her leadership and all of the work she's done with our Relay for Life. Now, please direct your attention to the video screens to learn more about the incredible contributions from Dr. Rebecca Perkins.
An associate professor of OB/GYN at the Boston University School of Medicine, Dr. Rebecca Perkins has studied HPV vaccination disparities since 2007. She is a recognized expert on HPV vaccination research, contributing to cutting-edge literature and speaking at academic, medical, and public health conventions across the nation. Her focus on HPV vaccination in low-income minority adolescents has proven key to addressing HPV-related cancers in underserved populations. Over the past decade, Dr. Perkins' volunteer work with the American Cancer Society has contributed to nationally increased HPV vaccination rates and reductions in cancer disparities. She has served as a member of the American Cancer Society's HPV Roundtable Steering Committee and has led the committee's Survivor Involvement Task Group, bringing the voices of survivors of HPV-related cancers into the national discourse. Through this work, she spearheaded the creation of HPV cancer survivor videos, now widely screened by the American Cancer Society and national partners. In recent years, Dr. Perkins has been a leader in developing the American Cancer Society's HPV Vax program, drawing from her research background to support training efforts. From concept to implementation, she has offered her expertise on HPV vaccination and interventions within federally qualified health centers. She has been instrumental not only in guiding internal teams, but in speaking to external health system staff at the HPV Vax Primary Care Boot Camp. With Dr. Perkins' support, the HPV Vax program is now positioned to honor its mission of increasing HPV vaccination rates for 11 and 12-year-olds across the nation. Dr. Perkins works tirelessly to translate American Cancer Society research into actionable knowledge, which she brings to health centers and partners nationwide. She has demonstrated passion, enthusiasm, and persistence in her work to understand the many dimensions of HPV-related cancer disparities. The American Cancer Society thanks Dr. Perkins for her outstanding service, and we're honored to recognize her with our Volunteer Leadership Award.
Move over a little bit. This award is presented to Dr. Rebecca Perkins in honor of her innovative research and dedication to cancer survivors, including her role in collaborating with our global headquarters staff, chairing the HPV Roundtable and the HPV Vaccinate Adolescents Against Cancer program. In addition, Dr. Perkins led a task force of HPV-related cancer survivors to share their stories and engage in a national discourse around HPV vaccination.
Thank you. This is a tremendous honor. I am a gynecologist by training, and I'm motivated every day by the patients I see to get rid of the scourge of HPV. Before I flew out, I spent this past weekend telling a 35-year-old woman who has never had children that her persistent HPV-16 infection had caused adenocarcinoma in situ, and she will now need a cone biopsy. And if she were done with childbearing, we would recommend a hysterectomy for her. And I do this every year in someone under the age of 40, generally caused by HPV-16 or 18. The good news is that we can get rid of HPV, especially I call them the HPV supervillains, 16 and 18, with vaccination. And it's a really exciting problem to work on. I was listening to Gary Reedy and his speech about the mission, relevance, focus, and habits of the American Cancer Society. And the mission of the American Cancer Society is to save lives. And with HPV vaccination, we have the potential to save the health of 500,000 women around the world every year and save the lives of half of those women by eliminating cervical cancer. The relevance, we come at a time when we actually have the potential to wipe out a kind of cancer that causes more death and destruction within young women and their families around the world than any other type of cancer. This has become a global focus. It is a focus of the American Cancer Society, but also a focus of the National Cancer Institutes, the CDC, and several international organizations. And then finally, habits. Cancer prevention habits in general are very difficult. Quitting smoking is very difficult. Controlling obesity is very difficult. Putting on sunscreen every time you go outside, very difficult. Getting 2 shots into children is not very difficult. In fact, it's something that we accomplish all around the world every day. Rwanda is actually right now the place with the highest HPV vaccination rates, over 80%. So this is something that can be done. And we're making new habits here in the United States. Finally, HPV vaccination is the new normal, with more than 60% of our young men and women getting vaccinated. But we have tremendous geographic disparities. There are places where HPV vaccination rates are over 80%, and there are places where they are much, much lower. So we have a lot of work to do. But I was very pleased to hear Dr. Wender say that he thinks we can eliminate cervical cancer in 25 to 30 years, because then I can retire. Thank you.